great actually. He was sat out in the chair but started feeling a bit dizzy, so I've popped him back to bed and he's still complaining. His heart rate's a little bit fast actually.
Okay. Have you done the blood pressure?
I have. It was 105 over 50.
Oh, right. And what is it? What's it normally?
Not sure actually. Should we have a look?
Yeah.
This chart. There we go. 150 over 90.
Okay.
So I'm not quite sure what to do about all of that.
Hello, John. How are you? How are you feeling?
Not great actually.
Oh, right. And are you feeling warm or
Quite cold.
quite cold? Oh, okay. Maybe we could get another blanket.
Yes,
couldn't we, really.
Yeah,
I just
get another blanket. Okay.
gonna feel there. Oh yes, you do feel quite cold. All right. Have we called the doctor yet or anything?
Yeah.
I need to
no,
ask you something, sister. Everything all right here? I just got a question about something else.
Oh right.
Is everything okay here?
Well, he's not. He's just John's just a little bit tachycardic and not feeling that great. Just done a blood pressure and it's 105 over 50. It's normally historical 150.
Oh, okay, fine. Let me think. I think on his morning bloods, he looks a bit. He was a bit dry. Is he? What about urine output? Have you passing urine okay?
Yeah, John, have you had a wee today?
Not today, I think. It was last night, around midnight.
Yeah, we haven't measured any since then actually.
Okay, fine. Okay, fine. He's not got a temperature, has he?
No, he's just saying he feels a bit cold.
Fine. Okay. Well, I don't think it's going to be sepsis. Sats are a bit low, so maybe you should give a bit of oxygen. And as the pressure's low, so we should give a bit of fluid. Let's give him 500 mils of saline.
Okay.
I'll prescribe it over a couple of hours. I'll come back and see him after that.
Lovely. All right then.
Okay. Right. Thanks. I'll come back to that question in a second.
Lovely.
All right, John. Try to make you feel a bit better, okay? Give you a bit of fluid. Okay.
Hi there. How's it going?
Hello, sister. Mr. Wells isn't feeling great actually. He was sitting out of bed in the chair, so feeling a bit dizzy. So I popped him back into bed. I checked his blood pressure. It's a little bit low. It's 105 over 50.
Right. What's it normally?
And it's normally 150 over 90.
Right. Okay.
His respiratory rate's a bit high as well. It's 28.
Right.
And his heart rate's high. It's over 120, which is so I'm quite concerned about him actually.
Yes.
He's still not feeling that well.
Okay. And his saturations?
91%, and I have to just pop some high flow oxygen on him.
Okay. Fine. And temperature?
It's cold, 35.6.
Right. Okay.
Yeah.
And Pascal?
7. I've just
Right.
done
I'm quite worried about that. Okay. And has he been to the toilet?
it. I did ask him actually because he wasn't. He's a little bit confused actually, but he
Right.
doesn't. He's told me that he hasn't been since midnight and he hasn't got a catheter in. So that's
Okay.
what made me more concerned about him. There's no
Absolutely.
urine output.
Okay. We probably just we need to get hold of the doctor really.
Yes,
don't
I
we?
think so. Yeah.
Okay.
Can I just ask you about the patient in bed 5?
Perfect timing. We're just chatting
what's going
about John here.
Hi, John.
And well, to me, it sounds like he's got a bit of he's got sepsis. Really, he seems to fit the criteria.
Okay, fine.
So just John, we're just going to have a little chat about you for a minute.
Okay.
So don't
So
worry.
you think it fits? Should we use the screening tool?
Yes.
Okay. Have you been through it already?
Well, we just kind of started off, but we're
All
good
right.
to go through it again.
Okay. So service criteria. So your heart rate above 90.
It's 120.
Oh, okay. Gosh. Respiratory rate raised.
28. Yeah.
Okay. Is he febrile?
No, he's very cold.
Oh, he's cold?
35.6.
Okay, fine. Well, that's 3. I know that's it. So he's definitely got SIRS. Any signs of infection? What's it? Chest? Is that okay?
Well, he's on. I put some oxygen on because he was feeling quite dizzy, and the saturation's only 91% on that high flow oxygen.
Okay, fine. Well, so it could be chest then, couldn't it? Because that's new. That wasn't like that before. Could be urine as well. Okay, well, I need to listen to the chest and do a chest X-ray. Maybe get some urine and dip it.
Yeah,
Has he been
well,
passing much urine?
No, that's a bit of a problem actually. We just asked him, and he's not peed since midnight, and he hasn't got a catheter in.
Okay, well, there's possibilities for infection then. So in terms of organ dysfunction, so you've not passed urine since midnight?
No.
Okay, well, that's definitely. And the pressure, pressure's okay, it's not less than 90, is it?
Well, it's 100 over 50, but his normal pressure's 150 over 90.
So we do have a drop of 40 from normal?
Yeah.
Okay, well that makes it, this is severe sepsis then, isn't it?
Yeah.
Okay, fine. We've got a care bundle for this, haven't we?
Yes, we have. I can just go and get it for you.
Great, okay, fine. Get the rest of his obs then.
Here we go.
Okay. Oh, great. Okay, fine. So what do we need to do? So we need to give him some oxygen.
Yes.
So that's about 94% now.
No, still 91.
Oh, should we turn it up then?
About 10 minutes.
Should we turn it up, oxygen up then? To
Yes.
get 94%.
Yeah.
And we need to give him some fluid. So I'll prescribe 500 mils of saline.
Okay.
Can you give over 15 minutes?
Yes.
Okay, so not through the pump.
Sure.
Just give it faster than 15 minutes, and then I'll stick around and see the effect
Okay.
on that.
Great.
Blood cultures, I'll take those in a second.
Lovely.
And antibiotics, I'll prescribe some empirical
Okay,
antibiotics
I'll
as
give this
well.
immediately that you've
That'd be
taken
great,
blood
yes.
cultures.
We need to do a gas and some bloods. Okay, so when I'm taking the cultures, I'll take a gas. I need to do a lactate on the gas. So where can you do that in theatres, or do I have to go to ICU for that?
I think we need to go to ITU to get the lactate. I don't think Jen
All right.
can just do it.
Could you call the porters
Yeah,
then now?
yeah,
Because it'll
straight
take them a
away.
while, probably, won't it,
No problem.
to come over? Okay. HP is fine. Okay, and strict fluid balance.
Okay.
So can you pass you in the bottle?
I think he was a little bit confused, as I say, but we'll try to use the bottle, and if not, we'll have to catheterise him.
All right, fine. But strict fluid balance, definitely.
Yes.
Okay. Well, I'll prescribe the fluid and the antibiotics, and you can
Okay.
give those now. If you can call the porters.
Yep, I can do that.
All right. And I better call the ICU and just let them know we've got someone with severe sepsis, just in case things don't work out. Okay.
Great, and I'll
Excellent.
tell the patient what's going on.
Thank you then.
All right, Mr. Wells, the doctor's just looked at your charts, okay? We're going to give you some oxygen and some fluid, and that should make you feel a bit better, okay?
Okay.
Hi, sister. How's this chap doing?
That last little fluid's gone through.
Okay, that's good. Okay, and what's his blood pressure now?
Still not great. It's only 87/39.
Oh, okay, let's give him another 500 mils of saline. I'll prescribe that now.
Okay. And the stats are also low. They're 91% on 15 litres.
Okay, that's not great at all. I did speak to my reg and he said this could be sepsis we're looking at, so I'm going to go and call the ICU in a minute. Did you give us antibiotics that I prescribed?
Oh, right. Oh, I'll give them now.
Thanks. Could you give those?
Yeah,
and
we'll do that.
can I ask you to see if you can go and find the ultrasound machine?
Yeah, I can do that.
I might have to put a line into this
Okay.
chap.
There we go.
All right, thanks. Okay, so how are we getting on here? How's the chap doing?
Well, he's had that second litre of fluid now, so he has.
Okay, and how's the pressure?
Still not responding.
Okay, right, well it's just been just over an hour since we started on the care bundle, so should we review everything, make sure we haven't missed anything and see where we're up to?
Sure.
John, I'm just going to have a little chat about things. Just hang on a
Have a
second.
look at that.
Yeah.
Thanks.
Okay.
Alright, so going through everything we've done for the hour from the bundle, so he's on high flow oxygen, isn't he?
Yeah.
Yeah, and it's sat above 94%?
There's just about 91 still.
Okay, fine. Fluid, we've given our boluses of fluid, and we've given 2 litres now, so we've got to stop. Cultures I've taken and sent off, and we've done a chest x-ray. Okay, so we've given the antibiotics, haven't we?
Yes, we have.
Yeah.
Okay, excellent. And the blood gases, we've got 2 now?
That's right. And the lactate has gone from 3.7 to 4.2.
Okay, that's a problem, isn't it? And fluid balance?
Well, he's still using the bottle,
Okay, that's fine.
but he's a little bit confused, so we'll persevere with that, and if not, we'll have to catheterise
Okay,
him.
I've always spoken to my reg about this, and I've always mentioned this to the ICU. Well, looking at this, he's still hypotensive despite what we've done.
Yeah.
The lactate's above 4,
Yeah.
so this is septic shock. Now, okay, so let's go on to the septic shock bundle then. So I need to speak to ICU again,
Yeah.
and tell them he probably does need to go to them, and we probably can't give much more fluids according to this, and he needs some noradrenaline. So can we do that here?
No, we can't.
Okay, so then I definitely need to speak to the ITU about this chap urgently. All right, in the meantime, I'm going to call the ICU. Can you get me the ultrasound machine?
Yeah.
Because I might be able to stick a line in to help with the noradrenaline administration.
Yeah.
All right, fine, thanks.